Hello everyone. This video is about flowing your day in the ED. This is what I call much rinse and repeat, but with a few twists. So, let's start our shift. The first thing you need to do is to check in. This is where you check in. Upper right corner, hamburger menu, check in. And if you click that, you'll get the check-in window. This is also the checkout window. So when you're done, you'll go to the same place and say checkout, and it shows you which patients you have, and you can decide to hand them over to other providers. Don't worry if you forget checking in. If you try to sign up for a patient and click on the MD column here to add your name to the patient, it'll open the sign-in window. However, if you're not checked in, it'll tell you to check in, and this will take you back to this window. In here, you have your name, your color, your role, your relationship, your default site if you find yourself going back to the same site more than others, and your display name in the system. Now that you've checked in, let's start taking care of a patient. This is the journey of one patient. The first thing you do is you're going to sign up, click on the column, and sign up for the patient. Once you've signed up, you're going to review the triage and the tracker, you review their vitals, and then you're going to move on to assessing them. This is really no different than what you do every single day. It's just in a different medium. You're going to review their medical records, their medications, you're going to do your history, you're going to do your physical, and then you're going to move on to writing your orders. Except this time your orders are electronic, are not on paper. And when you do that, you're going to do some documentation. So where you're going to type or dictate whatever your findings are. No different from what you do every day. Usually some time passes, and then you get into some reassessments and some procedures. Again, as you do a reassessment or you do a procedure, you're going to document in the chart. You will find yourself going back and forth sometimes, making more orders and reassessing again. Eventually, you're going to disposition the patient. In quick cases, you might find yourself going straight from assessment to disposition, and that is okay. And after you've dispositioned your patient, you're going to write your note. That completes your care. Now, you can do your note in the department, you can do it later, it doesn't matter. This is when you finish your note, you bring everything together into your visit note. It is important that you do that and sign it, because otherwise your care is not documented and your documentation in the record is still not signed off. Here are some QR codes for you for other videos that will help you look at documentation and creating notes, ordering in CPOE, discharging patients, and writing scripts. Now that we're taking care of one patient, we're going to take care of more patients. This is really a process of rinse and repeat. You pick up your first patient, and when you're done with your orders, you pick up your second patient, and when you're done with your orders, you pick up your third patient, and so on and so forth. And you'll find yourself going back to reassessments and more orders and dispositioning your patients as you go on through your day. Now, the twist. While most of our patients follow this trajectory, some of our patients don't. And these fall generally into three categories, what I call mini assessments, concomitant care, or handoffs. Let's talk about mini assessments first. These are things like, can I show you this ECG? Can I give this patient some Tylenol? Or you needing to order something on a patient at the end of your shift, but you're not going to continue their care. First thing you do, always, is sign up. Remember that once you're asked specifically about a patient, your duty to care has started. Now you have a duty to take care of them, you have a duty to respond to their needs, you have a duty to record what you have done, whatever care you've provided, but you also have the right to be paid for the care you provide. Do not touch a patient, do not talk about a patient without signing up. This is very important because it does a couple of things. First, it establishes your relationship with the patient, so you can find them later, you can document on them later, you can also bill for them later on your billing reports. Also, if you are the first physician in the patient's chart, we just captured a PIA. Now, you're going to do your usual care. However, I made the cube smaller to indicate you're usually going to do a focused review and a focused assessment, and you're going to order something or two. You're going to order the Tylenol or the Gravol, or you might order the X-ray. Once done, you are going to sign off. It is important that you sign off because that returns the patient to the pool of the patients that need to be seen. If you do not sign off, that patient will stay with you and nobody else will pick them up because you're already assigned to them. If that is your intention, by all means, keep them on your list. But if you're not going to continue their care, sign them off so that they go back to the pool. Now, once you've done, you're going to create a quick note. This is 2, 3, 4 lines, 5 lines, whatever you need, free text, document your care, sign it off, and it's there forever. Now, in some cases, if you've ordered things, you might want to go back and review them. I do that, or I make sure that another physician has picked up the patient, because any orders that I've given are mine unless the care has been passed on to somebody else. Let's talk about concomitant care. These are things like, can you provide anesthesia for a reduction? Can you help me with this procedure? Contribute to this major resuscitation. Again, first thing you do is you sign up. Creates a relationship with the patient. Now you can document on them, you can see their record, and you can find them later to build on them. Provide your care, whatever that may be, a procedure, anesthesia, etc. Sign off. You can keep them on your list somebody else has signed up on, but generally, if you're done with them, sign off so they fall off your My Patient list, which keeps it less cluttered. You're only seeing patients under your active care. Create your quick note, sign it off, and now it's the chart. There is a third twist that happens, which is handoffs. These are things like my shift is done and the patient's care is not done. It's also similar if you're doing a consultation, if you're handing over a patient to a consultant. This is basically the same process that you've done. You've signed up, reviewed, assessed, ordered, documented, reassessed. However, instead of your disposition being a discharge, your disposition is going to be a handoff and transfer out of the department or a consult. And we will do a demo later on in this video to show you how that's done. Again, once you're done with that, you still have to create your note. You bring all these documentations together into a signed off note that goes into the patient's chart. Well, let's start some demos. First, let's demo check in and out. Let's demo sign up and sign off. Hello everyone, and let's demo signing on and off for patients. I've just started my shift. I'm in St. Catherine's site. I'm going to go to the hamburger menu and I'm going to say check in. My site is already set up. I'm already known. I have my color and all I'm going to say is okay. And now I am in the system. Next thing I'm going to do is I'm going to sign up for a patient. Let's see, I want to sign up for E19. I'm looking at pod A now. I'm going to just filter this by unassigned. I know that they want me to see A19, so that is what I'm going to do. Right here, A19, I'm going to click and assign myself. And that's it. The patient's fine. It's dropped off the unassigned group in pod A. If I unfilter, you will see let's do them by room. A19 is my patient now. It's also showed up in my patients list. In fact, most of the time, except when you're picking up patients, you will be working in only two tabs. My patients, where you can see your patients, and reassessments, where reassessments come up. The rest really do not matter to you, only when you're picking up a patient. Now, Tim is treating a patient in A5 and want me to provide a procedural sedation for a cardioversion. So I'm going to go to pod A. What I'm going to do, I'm going to find A5 right here. Tim is already signed in, TSA. I'm going to click on it and I'm going to assign myself. And if you notice, now both of us are assigned to the patient. After I've provided my care to the patient and I'm done with the procedural sedation, I am going to click this again and unassign myself from the patient. Now it's only Tim's patient. Now let's check out from the department. This is my list of patients. I only have 2 active patients left. For the patient in A11, I'm going to hand this over to Tim Sainamont. However, patient in A19, I've already placed a consult. Now let's go to my checkout. I've given Tim handover. I've given the consultant handover. For the patient who is in A11, this one, I am going to search for the providers that are available. Tim is right here. And now what I'm going to do is I am going to assign this patient to Tim. And I'm going to hit OK. This patient is going to stay mine because I've already given him to a consultant. I'm going to hit OK. If I refresh, this patient should drop off my list. If I go back to APOD, bed 11, it is now assigned to Tim. And I have been checked out. Let us now do a demo of a mini assessment. Now let's demo a mini assessment. Let's say that the nurse asked me to see this patient on the EMS stretcher or in triage quickly. They've had a fall, they needed some analgesia. First thing I'm going to do is I'm going to sign up for the patient. I'll take the history, I'll decide what we want to do, and say, for example, what I want to do for this patient is I want to order an ankle x-ray. I also want to give them some quick medications. Let's give them hydromorphone. And now orders for signature. These are the 2 medications. 1 dose, IV, 1 missing field, reason for exam injury. I am going to sign and I am done. I'm not going to keep caring for the patient. I'm going to put them back in the pool and I will unassign myself. I still need to do one thing, which is to document a quick note. So I'm going to open the patient's chart. I'm going to say ED quick note, document here. 44-year-old female asked to see in triage period, healthy, no other medical history period, isolated injury to the left ankle period, tender on the lateral malleolus period, neurovascularly intact period, injury is closed period. Ordered ankle x-ray and analgesia period. I left her care with the emergency physician taking over his MRP period. Submit and sign. And now it's there. I can always add an addendum if I want. I go back to clinical documentations. My note, I'm going to modify it. Dr. St. Amant took over the care of the patient. Period. X-ray reported as normal. Period. And I'm done. Next, let's demo an end of shift handoff. Let's do a consult, a handover, or a transfer out. Okay, in my patients, I am going to consult this 3-year-old male to pediatrics before I finish my shift. Let me put in a consult. For some reason, it's not here, so what I'm going to do is I'm going to go to orders because consultation is an order. Let me see if it's in here under my consultations. It's not. Let me search for consult pediatrics. I'm going to add that. Okay. Let's order it. Modify. This is your order. Now, the consult pediatrics is good enough, but if you want to add a physician, that will connect them to the patient immediately in the back end from their list. So let me, and that's Rocio Monroy. It's an urgent consult. Consult reason pneumonia if I want to, and I'm going to sign my consult. I do need to do a couple of other things. I do need to add a diagnosis, an ED discharge. I'm going to go to diagnosis, pneumonia. Now, I don't want this as a chronic problem. I'm going to add no chronic problems. Now, in the order profile, there is no discharge until the consultant has seen the patient, either admitted them or discharged them. So that order comes from the consultant. I am going to document my final note. I had already entered all this as I've seen the patient before. I'm going to put in my impression and plan, and I'm going to save it. Now I'm going to create my ED note physician, which is my final note about this visit. There is nothing I want to change in this one. Sign and submit. I'm going to send a copy to Dr. Monroy as well. I'm going to sign this, and now I am done. To demo a transfer, let's pick another patient. Let's say if I want to transfer this patient out, I'm going to open the chart in my ED view and the orders. I'm going to search order for ED transfer. And let's say I want to transfer this patient to another site for some reason. Now it's in my orders. I'm going to always modify, never sign, look for the missing details. What do I have? Does a nurse need to accompany? Yes. Does an RT need to accompany? No. To ICU for lack of beds. At my site, transport mode by ambulance immediate transfer, family aware, Dr. Desson accepted the patient. I'm going to send that order. We are good. I think for this patient, I had already completed the documentation for them. Yes, I did. Here is my ED note for the NSTEMI. I'm going to go back to the patient's chart. I'm going to make sure that I have a diagnosis. This is diagnosis. This is a transfer order. And that's it. I don't need to sign off,
since the patient will stay under my name until they're transferred out.
and I'm done. This is a small demo. Let us order a test for a future visit. Let us order a quick test for another visit. Tests for another visits are sometimes handy, say if the patient's returning for an ultrasound tomorrow, or it's also handy in the urgent care centers when a patient's being transferred from one site to another site, say for a CT scan. Remember that visits in the emergency department transfer from one department to another are new encounters. This is a little bit different if you're admitting a patient to a different site. These will be a single encounter, and we'll tackle that later. The reason it is a single encounter, it is so that all the orders will carry on to the inpatient visit. So, for an order for a patient coming back at another time, whether to this department or another department, let's order an ultrasound on this patient. There are many ways to do that. I'm going to do it from the DI tab. And let's say I want an ultrasound abdomen complete. It's added to my box. I will go here again, try to sign it. Missing options, one missing option. Reason for exam, you know what? I'm going to dictate. Right upper quadrant pain, period. Rule out cholecystitis, period. That's done. This is what you're going to order. Order for a future visit is yes. Make sure the site is correct. Make sure the priority is urgent and sign it. And now you're going to ask what happens to this test. So if we go to the patient's chart and we go to the orders tab and we go to diagnostic imaging, you will see that this ultrasound here is unchecked. It is not active and it is on hold. When the patient comes back and registers for another visit, the nurse can go to the orders. This order will be there, and what they will do is they'll check it. You can right-click it, activate, sign. If I refresh, now the order is active for this visit. The same principles apply for a CT scan. I hope you really enjoyed this video. If you have any questions, you know how to reach me. Otherwise, thank you very much for your time.